Many patients with advanced cancer turn to religion to help them adapt to their illness.
Religious coping is simply defined as how a patient makes use of his or her religious faith to understand and adapt to crisis.
It's relying on your faith to help you deal with terminal illness.
To better understand the effects religion might have on these patients' medical care, Dr. Holly Prigerson of the Dana-Farber Cancer Institute and her colleague Dr. Andrea Phelps of Beth Israel Deaconess Medical Center led a team studying the treatment of 345 patients with advanced cancer, following up with them until their death.
What's nice about this study, or unusual about this study, is that it takes religious coping and it shows how it actually predicts subsequent care, which is an objective health outcome.
We found that positive religious coping was very commonly endorsed by patients with advanced cancer, and we wanted to get a reflection of how the normal ways people use their faith to cope would influence their treatment decisions.
Featured this week in JAMA, the Journal of the American Medical Association, the study found that patients who reported a high level of positive religious coping were about 3 times as likely to receive mechanical ventilation and intensive life-prolonging care during their last week of life than those who disclosed a low level.
What these findings indicate is that rather than economic factors like health insurance coverage, what's dictating the use of aggressive care at the end of life are important personal beliefs like religious coping. People who seek comfort in God to deal with their impending death are getting more aggressive care, intensive aggressive care at the end of life.
The researchers believe their findings could give clinicians greater insight into their patients who are terminally ill.
We need to understand that our patients are relying on their faith to understand their illness and to make decisions, difficult decisions, about care at the end of life.
New research with the potential to make a very difficult time just a little less so. Haley Weldon, the JAMA Report.